I take the towel and I can put it vertically or horizontally as long as the top of the towel is somewhere near the CT junction. And then I'll have him put his hands over his head this way. Remember, this is ulnar nerve. So if their neurodynamics for ulnar nerve are present, you want to be careful. So then once I have him here, I'm adducting. My hands are light, so you don't want to push their head into flexion. So then he puts his hands over mine and brings his elbows forward, and we're set. So see how I can move him? So he knows I have control, and I'm not doing a lot of effort. So then I can bring him into this position here, and I can have him take a nice breath in, after I did a pre-minute hold, of course, and then I can do a manipulation, like that. So then the towel's in the same position, but I have my knee here, and it's still the same position, but my knee sometimes gives a little bit better of a fulcrum. I can have him round through here. You can get into this position and have him lean, take a breath in and out. I'll have him lean forward and do a manipulation that way. So let's do that one more time. Okay, just relax for a second. Roll. Good. There. Okay. Bring your elbows forward. Like that. He's pretty stiff there. Usually I get an audible, but
You got it first one.
I did. Oh, okay. That's why. You don't necessarily need an audible, but for him I would have expected it just because of his restriction. Take a key grip, and I'm at basically T1. I bring my whole hand to the back of the neck, and I have him retract into my hand and relax. And basically his hand's retracting into me, so that is putting him in a better position. And then I push T1 up to straighten out that area a little bit. More neuromuscular at this point, saying, remember when you used to be in this position? So push back into me and relax and follow it up. Good. So you do that for a few minutes. I have my patients stare out onto the river as I stretch them into this position, talk to them about their home program, sleeping positions, different postural exercises they can do, awareness on how their head is turned with the monitor, how much time are they imploding on their phone, how much time are they spending driving, etc. The other technique I like to do, and for this I'll have you face me, and what we do is he crosses his arms like this, and I put my hands here, his feet are on the floor, and then you can just, people usually like this one. It's a nice mobilization in order to get to that CT junction. When I get to this point, I can also ask him to retract his shoulder blades and relax, and that will bring in some muscle assist. Sometimes I can say, can you just try to lift your elbows off me a little bit? That brings some of the extension in and relax. I like the shoulder blade retraction more. I've been playing around with that because I find that second one I showed you brings in too much upper trap. So this will help bring in lower trap and middle trap. As far as the stretch is concerned, 1, they can do corner. 2, they can do the noodle up to this way vertically. So they can take a swim noodle and lay on it. What I like to show them to do though is in standing. So go ahead and stand up, and you have your one thumb facing this way, the other thumb facing behind you, and you pretend there's a bungee cord between your thumbs, and you're thinking of not lordosing through here, but really trying to imagine that bungee cord and take a nice breath in and out. And it's almost forcing them to breathe through this lower part here as they stretch, and they hold it for 2 or 3 breaths, and then you switch and go the other direction. And it just feels like a nice stretch.